Pittsburgh's Talk Radio, 1360 WPTT. Lynn, Cullen.
Hey there, and welcome back. I don't want to look at that either. That is disgusting. Dr. William Stiles is here in the studio with me, and he's showing me pictures of what? Diseased lungs? Is that what that is? It's just
lungs.
So this is
This is disgusting.
Please. So this is the great Dr. William Stiles I've been telling you about, and one of the reasons he's here is, my gosh, we get so many questions about you, and also we got National, what is it, the Smokeout Day coming up?
Yeah, Smokeout Day. National Smokeout is November 20, and that's coming up here next week. No, this week. It's got to be Thursday. If today is
it?
what?
Okay. It's the 17th.
Yeah,
I can't believe it's November 17th. Yeah. Okay, so we thought we would talk about how you can kick cigarettes, right, through hypnosis.
Lynn, that caller you had earlier I thought was fantastic.
Yeah.
I mean, the guy's talking about hypnosis working, but I was listening on the way in, my wife and I in the car. He said something very, very important. You've got to be motivated. The subconscious mind, that's what we reach during hypnosis, has to have a reason to quit. Otherwise, the subconscious mind will continue to say, hey, it's time to smoke. You know, you're in your car. Car won't go without a cigarette. And so
I know that feeling. Yeah.
Yeah, you smoke.
Because I was a smoker
twice,
too. Yeah.
So he's so right about that. I was surprised he did so well in a hard chair. I like the easy, nice, relaxed.
Yeah, because it is about relaxation. How do you do that in a hard chair?
Exactly.
So motivation. Now, when I came to you about weight loss, though, I didn't feel like I was well motivated. I was just desperate. But
that's motivation.
Part of what you... Oh, is that motivation?
Well, sure.
Desperation?
You got a little desperation.
Oh.
You know, I don't want to get too technical here, but a lot of your listeners don't know about Maslow, the psychologist, and an unsatisfied need is always a motivator. And your frustration was a result of not having been successful with other methods you tried. Even, I think, a couple of hypnotists you mentioned.
Yes, I did.
Yeah,
it didn't work.
No. So down deep in, you were motivated to be successful, and we just had to tap into that. Two things. The subconscious mind, number one, loves you, and it's not going to let you get her. You should see her face. I say that she sparkles.
My subconscious mind loves me.
I tell people that sometimes. They say, well, thank God something does.
Yeah, right.
You know?
Indeed. But, sometimes we feel... the reason we would desperate people come to you is because we're not treating ourselves like we love ourselves.
That's
we're hurting ourselves with cigarettes. Yeah. We're hurting ourselves by being overweight and taxing our hearts. So this comes as a big shock when you say that inside you love yourself, because that's what we've lost track of.
We have, and I'd like to illustrate, just to prove the point, something very, very direct. If you were standing on a curb and you stepped off and you suddenly notice that a bus is coming and going to run you over, your subconscious mind will grab hold of all of your muscles, pull you right back on the sidewalk. Then it'll give you back your conscious mind. You see, it loves you. It wants to protect you from harm. That's the first thing, and I'll get back to it. The second thing is that it is your servant. It'll truly do what you really want, and you repeatedly tell it that you want this particular thing. But this love you thing is the very, very best. Again, your earlier caller says, he loved his potential, I think it was potential grandchild, and then he loved the fact that he could be with her and he could watch her grow up. Now, that's a centrist thing, too. He loved himself enough to want to give him the pleasure of seeing that child grow. And so it all comes from that. And whenever we haven't done something about saving our lives from extra weight or smoking or some of the other bad habits, too, when we haven't done something about that, the subconscious mind just says, keep smoking, that's your pleasure. I love you. Don't forget your pleasure. And so it's sort of aberrant the way the subconscious mind tries to please you. So what do? I have no power. So
What do you mean you don't have any power?
I don't want to kill it here, but I have no power. But the words, when they get into your mind, those words are very powerful at the subconscious level. For instance, when I give you a suggestion, the words, of course, have no power to begin with. When you think about them, then they still have no power. Because if that was true, people who keep thinking about losing weight or stopping smoking would stop. Now, what's the hypnotist's job? Through technique, through, the method, need to get that word, that which is an idea. We need to get that idea deeply into the subconscious mind, the habit control center, the one that will pay attention, that will do what you want, the one that loves you, so the subconscious mind then reacts.
So
it doesn't react to what's deeply in. Excuse me.
So your job is you plant. You plant
right.
that thought in the fertile ground of our unconscious. Subconscious? Unconscious.
Subconscious. I don't like, a lot of hypnotists use the word unconscious, and you're not unconscious.
No, you're not.
When you work with
you're
me,
not.
you know that.
No, I know.
Yeah, okay.
I know.
Into the subconscious, that's right.
Okay, so you plant it there, and then it allows that part of you that loves yourself to use that.
Yes.
It's like you just
to grab hold.
Right. It gives it the right message.
That is correct.
Right.
And then, of course, you will respond to that. Now, the subconscious is so very, very powerful that a good idea, a new idea put into the subconscious then pretty much overrides the old ideas. And even people that are addicted three ways: chemically, emotionally, and psychologically. The chemical addiction, of course, is the nicotine. That's out of the system in 72 hours. Nicotine receptors quiet down in 4 to 5 days. But the emotional habitual addiction really lasts for about 20 days. And I help people get through that with a method that I give them, a mantra. So as they say it, it triggers the subconscious mind and causes those feelings to subside. They get through day by day by day. In 20 days, then the habit is pretty much gone.
You're listening to the voice that wormed its way into my subconscious mind and helped me. And we're talking about the use of hypnosis to help you, and specifically because National Smokeout Day is coming up this week, and a lot of you probably would like to get off cigarettes but can't conceive that it's possible. And we're focusing on stopping smoking because
a lot of people want to. Matter of fact, a lot of people have, because it's been 15 years and 42 million Americans have stopped. Then there are others that have tried and tried and tried and tried.
Can't do it.
They just, they don't think they can do it. They've tried the patch. That's like giving alcohol to an alcoholic. Can you see the analogy there?
Sure. It doesn't really get you off the drug, does it?
No. It saves the lungs.
Yeah.
And then there are people that try the nicotine gum. And I had a lady in. She's spending more money on the nicotine gum than she ever did on cigarettes. It's a shame. They still are putting the poison in the body. And Lynn, nicotine is one of the most powerful poisons in the world. They use it as an insecticide in South America.
Really?
It kills bugs dead. So it has a good use. 1 thimbleful of liquid nicotine. Now, we don't get that much in cigarettes, cigars, pipe, or whatever. But 1 thimbleful would kill a horse or any other animal that size if injected in about 3 minutes. It causes tachycardia. And smokers know what that is. They can smoke and they get that lift, and their hearts are going more rapidly. But the real problem with that, of course, is the nicotine also restricts the blood vessels. And so your heart's going faster, you get an adrenaline jolt, you have restricted blood vessels, and that causes stroke. Not in everybody, of course, but it causes heart disease, and those constricted vessels also wrinkle faces.
Yes, they do. I know. They say
seen it?
smokers have a lot. They age, in a superficial way, it seems. But your face, you dry up, huh?
Yeah. Well, ladies are generally softer. They have that nice adipose tissue underneath the skin. And by smoking, you constrict the blood vessels and at the microcapillary level. And you're not feeding that adipose tissue. You're not feeding the collagen around the eyes. And, of course, the wrinkling occurs naturally. I've had people, in fact, I remember one lady who runs a beauty shop call me in 3 weeks, and she said she can't believe the improvement of her complexion after stopping smoking.
Oh, really? So it does, you can reverse some of the damage that you've done?
You can plump out the face, the adipose tissue right under the skin, and smooth out some of the wrinkling. You're not going to get that collagen to become unstiff, and so for those deep-in wrinkles. But the skin that goes over it becomes smoother. You bet. They look much better. Of course, they feel better, getting more oxygen.
Right.
No carbon monoxide.
People worry, though, that if they stop smoking, they're just going to eat. They're going to gain weight.
And I'm worried about that, too. Every time they come in, and, you have in fact, it's not right here.
Okay.
You have a tape I sent you. You may not have had a chance to listen to it, of people who have stopped smoking and lost 15 pounds. And I give them the very tape that I gave you on super fat burning foods. And I teach them during the session that there are 30 basic foods that they need to add to their eating program. And it does two things. It pulls bile out of the body, thus helping to lose weight. It's a good substitute for smoking to be chewing on these foods. So I guess there's a third thing it does too. Because of all the live enzymes, it helps to repair the cells in the lungs. And the lungs will repair.
Yes, the lungs will repair. You can get baby pink lungs again, right?
It takes a while. But you
Okay,
can.
time to oversell it a little bit here.
No, it's true. Well, I had to caution.
Well, I appreciate that.
It's marvelous. I just think it's wonderful how we have these healing powers within our body. And many people have abused their bodies with all of this hot smoke going down into the lungs. And imagine that. It's like smoking your lungs up from the inside out as if they were a ham hanging in a smokehouse. And think about how that smoke goes deeply, deeply into the flesh of the ham, right down to the bone. That's why it's done. And the outside of it gets hard and crusty, like the emphysema lungs of a smoker of 30, 40 years. Unlike the ham, the lungs are alive. And those healing powers are there, recuperative powers. And slowly but surely, the lungs clear. Now, there's a radio friend of yours that even talked about it. You're searching, I see you're looking. Cigna.
Oh, sure.
Yeah, he talked about it.
Yeah.
That after, I think it's almost 3 years now.
Right.
And he had a CAT scan, and his lungs are nearly pink again. 51 years, 3 packs a day.
Jeez.
That's nice.
Yeah, it's wonderful.
Yeah.
So your lungs can live again.
They can live again. Now, this picture I have.
I don't want to look at that disgusting picture. It is so awful.
Every time I show it to you, Lynn, you turn away and look out the window.
Why would that be? It's pretty disgusting.
This will not heal.
No.
It's so bad. In fact, the only reason I have it is the person died. For heaven's sakes, I wouldn't have that.
That's
picture.
right. That person's dead.
But this is typical of, and I don't want your listeners to get turned off. We have to do a little aversion therapy. Well, again, your listener who called in said that. They showed pictures.
Yes.
And as you know, in my outer office, before people see me, I have them go through a manual.
Yeah, you did aversion therapy with me.
That's right.
That was good. That worked. That was disgusting what you were saying.
In fact,
there are pictures of fat surrounding my intestines.
Oh, you remember
intruding
that.
it was grotesque. Yeah.
Laying on the liver, the
Ugh.
kidneys,
Yeah.
and all that.
Yeah.
But we need to face reality. What's happening? 380,000 people are dying every year from too much weight. Over 500,000 are dying from the use of tobacco. And so I have them just look at this. And then I ease up a little bit after they've looked at my pictures in my manual. I have them listen to a tape. Remember that?
Yes.
I'm going to have you recall something else you obviously did remember too. But I have them listen to the tape. Now, the tape is nice. It explains hypnosis and how it works. The 7 most asked questions about hypnosis, answers them all before they see me. And then there are testimonies from people who have been successful. Remember that?
Yeah.
Were you still skeptical at that point?
I was getting a little less skeptical.
Little less, okay.
Yeah, you won me over once I got into the office.
Okay. Well, yeah, that's all prep work.
Yeah.
And
He softens you up, and then, man.
well, you're pummeled with those
yeah.
horrible pictures first.
Really. This is Dr. William Stiles, the guy you hear me talking about all the time, and you can hear, you got a perfect voice for what you do.
Well, thanks.
I mean, if you had if you had my voice, I couldn't be a hypnotist.
Oh,
because
sure you can.
How do you relax with this voice in your head? I mean, it was, God, shut her up. No, but you've got this, mellifluous sort of, nice voice.
Nice word.
That's right. Mellifluous.
Mellifluous.
Mellifluous. Do you want to talk a little bit about, sometimes when I'm telling people about you, I worry that they think of hypnosis as some weird thing.
Yes.
This loss of, they don't know what the heck it is, you're doing. I mean, the fact is, I've told them that medical science, mainstream medicine recognizes the value of hypnosis and increasingly is willing to entertain its use for pain control, for relaxation, for all kinds of stuff, right?
In fact, right now, at last count, we have 64 local medical doctors referring to our clinic.
Really?
And actually, Lynn, that was without, sending brochures to them. They've obviously heard about the clinic from you and other folks on the radio. They're absolutely delighted to have somebody to help them, particularly with pain, as you mentioned, and anxiety, fears, phobias, anxiety, and the stop smoking. A lot of the doctors that I talk to are extremely frustrated over the fact that they can tell their patients to do this or to do that, and visit after visit, everything's the same, nothing has happened. And so they like having an ancillary therapist that can help them accomplish that. It's not weird, though. In fact, it's so overblown by visions of Hollywood. You're under my power. I will suck your blood and all that stuff. I said that. I was teaching a group of 5 I had, and Lynn goes, well, just suck the fat.
Yeah, suck that fat.
She wanted an internal liposuction. No hands on there. But no, it's just a matter, as we were saying a little bit earlier, of getting a series of suggestions. Now, for every modality, I have anywhere between 60 to 85 well worked out, proven suggestions. I call what I do a multiphasic approach. And I start loading your mind, as I said earlier, in the outer office. Then, when you come in, I explain exactly what we're going to do. And of course, I'll ask questions and I'll make sure how people feel in the sense of what bothers them most about their particular problem or condition. Mm-hmm. And I'm pretty much creating the suggestions on the spot that will match their personalities and their needs.
How do you do that in a group situation?
In a group situation, I go through the hypnosis and have them reach what's called alpha state. And again, that's not weird. That's where they relax, and as you relax your body, you automatically go into, let me say, it's like a daydreaming state. Mm-hmm. Now, I could get technical and say your brain waves are running 13 to 8 cycles per second, as opposed to wide awake 14 to 18 cycles per second, et cetera, et cetera. But you get in the state where pretty much your resistance is low. You're not going to negate things I say. as long as they're reasonable and not scary. And everything's reasonable and not scary. Now, before the group session, I only do 5 at a time. Beyond that, it's cumbersome. So before the group, my office staff brings me in the forms that are filled out. And I have all the upfront questions that will give me the information I need. And before I see the people, while they're in the outer office, I study each and every one. And then I organize my thoughts, I make the notes, much like you would here when you're going to talk about something. So I have the 5 people, and I induce that first state down into alpha. I have to be careful. Some of them fall way down into theta and delta, which is sleep.
What's that?
Yeah, that's it. You got it. I have a staff I like to probe them with because they interfere with the rest of the group. But to shorten this up a little.
So people sometimes
you do that very well.
They fall asleep. Yeah.
Particularly older guys who are heavy.
They start snoring. Oh, that's funny.
But after we induce the state, I then give the general suggestions, which are all proven. They work well.
Sure.
But then I talk to each one specifically. And even though they don't know each other, it's okay. Because I'm editing in my little head at the same time. And what I'm saying to this person is apropos for that person, but I add a little bit more of the general.
So that it ends up being helpful to
everybody. You've got it.
Now, our program director just brought in a fax or an email, and listen to this, apropos of what we were just talking about. It says, "Can hypnotism cure snoring?"
Wow! Is that ever on?
No, it causes snoring.
It causes snoring.
Well, in your case, yeah, you get people so relaxed they fall asleep. Well, I don't think it would cure snoring. That's a physical thing.
That is a physical thing right in the back of the throat mostly.
Right.
But what we have done in that case is, and I've done it for people that have a problem sleeping on one side causing a sore hip or a sore shoulder. They have this comfort position. Well, most people who are snoring are on their backs. And so what I do is give them a post-hypnotic suggestion that as they go on their back, they become somewhat uncomfortable and they start to roll over on their side and even on their stomach. And so what we're doing is teaching them to sleep in another position. You know, they put those balls on the back. They will take a pin with like a tennis ball or something and put it in someone's back. So when the person rolls over, then they have to roll. Yeah, they're uncomfortable. I do the same thing with hypnosis. So the answer generally, I guess, is yes. You can change position to get the snoring under control.
All right.
Okay.
Dr. William Stiles is my guest. You know, I've been talking about him for some time. Number here is 412-333-1360 if you have some questions for Dr. Stiles. I'm Lynn Cullen. This is Pittsburgh's Talk Radio 1360 WPTT.
As they start to come up again. And frankly, I was a smoker, 2 packs a day, cigars, and I even developed some emphysema in my upper left lung. So I'm very passionate about this. And I know that one puff is going to re-addict. It's going to feel good, and then you're going to want another, and then another, and then you're going to have the pack.
And that's exactly what happened. I had a moment of stress. I was in, of all place, Kennywood Park, couldn't find my daughter. And I went up to a man and asked him for a cigarette. I've never done that in my life.
Stranger. Now, isn't that like an addict?
Wow.
Yes, and I know I don't have any. Please, can you light my cigarette also? It was so bad because I couldn't find my daughter. And it was that moment of stress that just put me right over the edge.
Well,
you know?
Well, we can get you back. And as far as the weight goes, I said earlier, I do a little weight program with you at the same time. And in a very practical way. I give you a list of foods to eat for the first 2 weeks that are going to pull fat out. Most of my people lose weight when they stop smoking because I pay attention to that. And during the hypnosis, I program into your mind that you're not going to use a snack as a substitute.
Right.
If you're able, I like you, whenever you're nervous, get up and walk. I don't care if you walk around from the living room to the dining room or around your house. It only takes 2 minutes when you're physically active. Plus, with the mantra I give you to stop smoking, it only takes 2 minutes for the urge to completely, like I like to say, fade away.
I learned that the last time when I stopped smoking, that it was only a matter of a minute or two, and then it was gone.
Absolutely.
And I was so happy with that, but then that 1 minute got me, I'm afraid.
All right. Hey, Maureen, good luck. You sound like somebody, as Dr. Stiles says, who can do it.
Thank you so much, Lynn, for bringing Dr. Stiles on, and good luck to you. Thank you so much, both of you. Bye-bye.
All right, bye-bye. Oh, boy. Not enough of you to go around, I'm telling you.
Well, I'm thinking about training people, but you made a comment to me, and I have to rethink it here, and I don't know.
Well, there's only okay. We'll talk about that. I mean, there's obviously a certain skill set that you would learn to be able to do what you do.
That I can.
But on the other hand, it's a you have to have this desire to help people. You have to be interested in people. You have to, I think, have the right voice as you have, the right manner.
Right.
And that's not a certainty with people who might be thinking, hey, I'm going to get part of what this guy's got going. Look at this. This is something. I'm going to go be a hypnotist.
See, that's what you said to me.
Well, that's right. That's right. We got to take a quick break. I'll be back with Dr. William Stiles after this.
It's the last quarter of the year. 1360 WPTT. Lynn Cullen.
All right, here we are, Dr. William Stiles. How'd you get into this? Were you how'd you really? How did you?
Do I really have to tell you?
You don't want to?
Oh, well, I was 16 years old and I started doing hypnosis.
You're kidding.
No, and I've gone to school for other things, became a psychologist, a PhD, all that stuff, and I just love the idea of being able to help people get into their own minds and causing these, boy, I hate using this word, but I have to, for these people, these little miracles in their lives.
But
it's in their minds, and I like helping to do that. And when I was 16, this is crazy. I thought, oh, this will help me get more girls.
That's a prime motivator always.
Yeah,
right.
I soon found out, hey, if there's no motivation, it doesn't work.
How is it supposed to help you get girls?
Oh, I don't know. That's before I started studying it, But I became so fascinated. There wasn't much literature at the time, and so I read everything in the library. I remember a fellow on the West Coast. He's 86 now, and I talked to him on the phone last year by the name of Melvin Powers, of all names. And he had this little book on how to hypnotize. And it formed the very basis of what we call hypnotic induction. And that's when I actually started hypnosis. And, of course, I practice on family and friends. And even I was amazed at how effective it was. But we all have the same mind. It can be manipulated.
Is everybody hypnotizable? Because some people say, I could never be hypnotized.
No, see, when people say I could never be hypnotized, what they're thinking is they have a very strong mind, and they're going to resist what I do. In that case, they're right, because they are resistant. But everybody that is intelligent and has enough imagination, in many cases, to visualize what I ask them to, or if they're not visualizing, at least imagine it. And they can be, quote, hypnotized, because hypnosis is nothing more than a slightly altered state of consciousness, where they're down into that dreamlike state and suggestions go into their minds very easily. That's all there is to it.
Is it much different than a state that you would get in with just meditation?
No, very much the same.
It is.
This alpha state I keep talking about. Yeah. It's called the hypnotic state. That's the state of learning, the state of suggestibility, and that's the key, the state of imagination and meditation. I'm looking at a chart I have in my office in my mind right now that just says those exact things. And we as Westerners, I'm talking about worldwide, need to learn more of that when we're young, so that we have the opportunity of programming our own subconscious mind. Everybody can be hypnotized. Everybody.
Ha! So there. I mean, I've got a strong will and a strong
Absolutely.
mind, and I'm very hypnotizable.
Yes.
I think.
As long as someone isn't telling you something
You don't wanna
patently stupid
Right.
or something that sounds harmful. Like I was a little taken back when the lady said she went, through this 7-week course of smoke cessation, and these people are suggesting you might gain weight. I would prefer, they say, here are methods to make sure that doesn't happen.
Uh-huh.
I mean, I recognize the problem, and I give the method so it doesn't happen.
Right.
Sure.
Right. No, you do. You do.
Yeah.
You do. So, okay, National Smokeout Day coming up.
Right.
And guys, know that hypnosis is a tool that can be used to help you.
And I imagine many people here have failed. They've tried the patch. Many that are listening, the nicotine gum. They've tried cold turkey. They've tried group hypnosis sessions, and in those cases that it didn't work for them. I imagine a lot of them, hey, this is a key, Lynn, started as a teenager. The average starting age is 14, so it becomes so big a habit in their lives, they can't even remember when they didn't smoke.
Can't imagine not smoking.
I remember when I was 10 years old. I'm going on 65 now, so that's many years back.
Yeah.
But I remember at 10 going to the store to buy Lucky Strikes for my father.
Wow.
And I saw a sign, and I'm referring to tobacco company advertising. I saw a sign that says, 4 out of 5 doctors recommend Lucky Strikes for your nerves. And as a little kid, see, I'm getting sold. As a little kid, I'm thinking,
wow.
I'm nervous. I can't wait to smoke.
Wow. Isn't that something? 4 out of that. Jeez.
4 out of 5. And I have old ads in my office I share with anybody. I've gotten all of these old tobacco company ads to where they're talking about the advantages of health. And honestly, up until...
How cigarettes make you healthy.
Oh, yeah.
Wow.
I was in my late 20s when, as I would smoke, I'd get a cold, and so I'd switch to menthol so that I didn't cough so much.
Isn't that something?
And what's happening is the little ciliae in the bronchial tubes close down, so you don't cough as much with menthol. But the tragedy of that is you're able to suck more smoke into your lungs. And with the ciliae paralyzed, you get more of the road debris, more of the pollutants that are in the air.
All that stuff just comes right on in.
Yeah, it gets worse and worse and worse.
Because the cilia are like these little scrubbers that are grabbing
That's what they are.
stuff.
That's right.
Yeah.
And so a smoker is not only getting the disease-causing poisons, and there are 200 of them in the cigarette smoke, but they're getting everything that's out in the air and more of it than people who don't smoke.
Well, so I guess what you're trying to say is stop smoking. It's killing you. It's killing you.
Yes.
And know that you can. And know that you can. Because that's
right.
what you tell folks when you got your hands on them.
Absolutely.
Right.
They can smoke. I'm dedicated to helping them. You know of my dedication. You've been in my office.
Mm-hmm.
I don't cheat on therapy. I'm not there to rush people through.
Nope.
I'd rather extend them out by weeks so that we do a good job, everything we possibly can.
Right.
And you've heard all the testimonies. You experienced yourself the weight loss. But, Lynn, you've heard those testimonies on those people that quit smoking. A lot of them left the office and never had a single desire to smoke.
I know.
It's not everybody. No withdrawal either.
No withdrawal. It's amazing.
It is. It amazes me.
Well, I know. Well, you did it. It's just amazing.
Yeah.
So, guys, this is the guy I've been talking about, Dr. William Stiles, and his clinic in Bellevue. He's pretty booked up, but he's worth waiting for if you've got the desire. Well,
thank you for having me.
Thank you.
All right.
Thank you. Now that I'm a hot babe again.
Yeah.
12 noon, folks. I'll be back in 5. Lynn Cullen. 5. Lynn Cullen. 5.